introductions, endocrine disrupting chemicals are harmful chemicals that cause the endocrine system in humans to malfunction. Various levels of exposure to this endocrine chemical in the air we breathe and the food we consume has been established by research study. Food is one among the most important routes for human EDC consumption. Humans preferentially expose themselves to diet, although lactation is a significant route for removal. This process, however, results in the toxic load being transferred to the newborn. Furthermore, many EDC can bioaccumulate out the food chains, resulting in chemical biomagnification and posing health concerns to future generations.
According to the International Programme on Chemical Safety 2002, endocrine disrupting chemicals are defined as an external chemical or mixture that change the functions of the endocrine system and cause undesirable health consequences in an entire organism, its offspring, or the subpopulation.
For endocrine disrupting chemicals in food, we will look at the example of EDCs and their uses. The first one is bisphenol A or BPA. It is a carbon-based synthetic compound associated with diphenylmethane derivative and bisphenol. BPA is used as a lining of food entering packages, reusable water and infant bottles, water cooler, medical devices, and household electronics. Next, the chlorodiphényl trichloroethane (DDT) is also known to be an endocrine disruptor. It was also widely used in agriculture until it was banned worldwide. DDT is listed as a POP in the Stockholm Convention and it is primarily used in vector control. Next, dioxin. Dioxin are POPs under the Stockholm Convention and have been included in the Convention's unintentional release. It is unintentional release in a variety of industrial processes and it has no use as such. And lastly, phthalates. Phthalates, also known as phthalic ester, and it is primarily used as plasticizers. They are added to plastic to improve their flexibility, transparency, durability, and longevity. It is used in personal care products, cosmetic and food contact materials such as bottles, capsules for canned and bottled food, and can lining.
First and foremost is bisphenol A, or known as BPA. According to WHO and FAO 2010, the acute toxicity of BPA is minimal. The study carried out by Food and Environmental Hygiene Department 2012 shows that toxicological effect of BPA includes the reduction of sperm quality, sexual dysfunction of adult men, as well as behavioral abnormalities in young women. Other than that is dichlorodiphényl trichloroethane, or known as DDT. According to the study carried out by Marx et al. And Ribas-Fito and et al., DDT exposure in utero has been related to impaired psychomotor and mental performance in offspring, including memory, linguistic abilities, and attention. Dioxin is also one of the endocrine disrupting chemicals that bioaccumulate throughout the food chain and remain in the environment. According to the WHO 2010, short-term exposure to high level of dioxin and its substitute at the workplace or as a result of industrial accidents or poisonings can produce skin lesion known as chloracne, and this condition usually occurs in children. Lastly is the phthalates. Its presence in food are mostly caused by phthalates contamination via packaging materials. The exposure of phthalates is linked to a variety of health problems, including reproductive and endocrine difficulties. According to the study carried out by Wang, Y.X. et al., phthalates can cause phthalate syndrome, or even called testicular dysgenesis syndrome in men. Not only that, these chemicals also have been linked to a variety of human cancers, including skin, breast, prostate, and liver cancer.
Situation. The majority of endocrine disrupting chemicals are manufactured. Some chemicals are also released unintentionally as a result of anthropogenic as well as natural sources. People are exposed to EDC in their daily life because they are found in thousands of items and as contaminant in foods. There is currently no authoritative list of EDC available and there are many potential EDC. However, the major EDC of concern are mostly man-made chemicals with a high manufacturing volume or persistent environmental pollutant. Organochlorine insecticide as well as industrial chemicals such as dioxin and dioxin like PCB, PBA, and styrene and phthalates are among them. The possible EDC list above may be present in food as contaminant from the environment and food contact material such as food packaging, container, and tableware. Classification of EDC. The first one is industrial application, consumer product use, organochlorine pesticide, and the last one is environmental byproduct. While category of EDC are: first, industrial application and consumer product; second, organochlorine pesticide; and third, environmental byproduct. For issue, in recent years, experts and the general public have been increasingly concerned about the potential negative effect of EDC exposure. One of the harmful effects of potential health hazard that is evaluated in risk assessment is endocrine disruption. If a potential health hazard in food is discovered, an adequate risk assessment will be done to protect public health. Exposure to several EDC resulted in low dose effect as well as in potential synergy impact. In 2002, the WHO IPCS analyzing the relationship between EDC and hormone health issues such as reproduction, endometriosis, precocious puberty, neurological function, immunological function, and various types of cancer.
For prevention of toxicological effect, manufacturers and suppliers of food contact materials should adopt good manufacturing practices and comply with recognized standards such as Food and Drug Administration (FDA). Avoid unnecessary exposure or use of chemicals, maintain a balanced and varied diet, minimize the use of personal care and cosmetic products containing hazardous chemicals, and always look at labels to avoid certain chemicals linked to hormone disruption. And lastly, buy food and food contact material from reliable suppliers and always follow manufacturer's instructions and pay attention to the suitability of the product. Misuse of this product may cause the migration of potential EDCs from the plastic material to food.
In conclusion, humans are commonly exposed to endocrine disrupting chemicals through the consumption of foods. Bisphenol A, dioxin, DDT, and phthalates are examples of endocrine disrupting chemicals that are present in food and food products. The exposure to these chemicals could lead to some toxicological effects, thus affecting the human body. Some preventive measures must be taken in order to prevent and reduce the toxicological effect caused by these harmful chemicals, particularly in foods.
Question 1. What are the other EDCs that have been used in industrial application and consumer products? Answer. The first one is triclosan. It is used as preservative and antibacterial agent in personal care product, industrial and household product, such as detergent, toothpaste, and mouthwash. Next, mercury, which is a naturally occurring substances. Mercury is used in various products and processes which include healthcare instruments, batteries, paint, and cosmetics. And lastly, polychlorinated biphenyl or PCBs. It's been widely used in electrical equipment and as pesticides in paint, plastic, and rubber products. Question 2. Why was dichlorodiphenyl trichloroethane (DDT) banned worldwide? Answer. DDT was developed as an insecticide, however, it led to serious health conditions in both humans and animals. This dangerous compound is thought to be both carcinogen and endocrine disruptor. A chemical called DDE is an androgen receptor antagonist. It binds to the same receptor that male sex hormone bind to, thus reducing the effect of certain hormones like testosterone. The negative human and animal effect caused by DDT were far too prevalent to allow it to continue being used, and it was banned in all countries of the world since 1973.